Thank you, listeners, for joining us for today's Elko Live show here on KELK. We're very pleased to feature our guest from Nevada Health Centers, Elko Family Medical and Dental. Our guests today are Patrick Rogers, who's the Clinical Director of Behavioral Health Services, and Erin Bernius has joined us. She's the Marketing Outreach Specialist. And it's almost hard to decide where to start, Erin, because our Nevada Health Centers does so much for our community. So thank you for coming today.
Thank you for having us.
So obviously we will start with the behavioral health update because we know, Erin, that that's what the community is really interested in right now. We know that the issues been before City Council, for example, but there's been a lot of movement, especially since the pandemic, in trying to meet so many different needs.
Yes, and I will say that Elko is a tight community, and behavioral health and mental health are so important. And when you talk to most people, they would agree. And there are resources available in our community. It's just about getting the word out there and getting people educated on what is there. And that's why, these networking events, these events we have in town are so important, because you can see someone's face and you can put their face to a name in their organization. And I think that's exactly what we've done at Nevada Health Centers, is by attending these events, we're saying, hey, we're here for you.
Well, it certainly shows, Erin Bernius, in the work that you've been doing, not only as the marketing outreach specialist, but other staff members and the high visibility of the team as they go out in the community. And so that's why it's a great opportunity to get to talk to Patrick today. Thank you for bringing Patrick along. So
happy to be here.
Thank you. Patrick, you're the Clinical Director of Behavioral Health Services, and the Nevada Health Centers takes this wonderful approach in integrating healthcare, right? This sort of holistic mind and body. Would you mind talking about that for us?
Yeah, I think that I usually start these conversations off with an example. If anybody's ever had a bad cold or the flu, what was your mood? It certainly wasn't the happiest day of your life. And if you're experiencing high levels of pain, your anxiety goes up and depression sets in and your mood is much lower. And so I think that's evidence enough to say how connected that our bodies and our minds really are. And so that mind-body connection is really important when it comes to treating and intervening on behavioral health. We can't separate the two of them. We have to kind of treat the whole person.
And that's why our Nevada Health Centers in this one convenient location is able to address all these various issues, right? If someone's coming in with a mental health issue, you're going to be able to maybe get a baseline on what's going on with their physical condition.
Yeah. What we know is about 75% nationally, 75% of all medical visits have some sort of a mental or behavioral health component to them. And that's quite large, and that's a large burden for our primary care providers to try to be able to treat that without having that expertise. Imagine that if 75% of all patients that came in had some sort of cardiovascular issue, like you'd want a cardiologist on staff there to be able to assist and to help guide and do what we refer to as warm handoffs or a curbside consultation, which is where you can consult with a professional in that area on the spot while the patient is there.
And I'm glad you mentioned, Patrick, that there are other healthcare providers. Just as Erin started us off by explaining, there's this great collaboration in the community. Everybody is really busy. It also takes a toll on the provider, and that's why Nevada Health Centers is a leader in doing things such as the Behavioral Health Summit.
Yeah, and I think that's a great opportunity for a community, really, to kind of come together and to share ideas. I think talk a little bit about where we've come from and the direction that we really need to go, and really start talking about how do we resolve some of the issues that we're having in the mental and behavioral health world, not just as professionals, but as an entire community.
And is that a summit, obviously, that the health centers, maybe, Erin, you could talk more about that too, that the health center sponsored this year and has been played a big role in making sure this is successful?
Yeah, so the Behavioral Health Summit, this is their third year of holding the event, and we've attended every year. The first year Patrick went, And then the last 2 years we have sponsored. We're sponsoring this year's. And I attended last year, and it's quite amazing what the power of talk can do among people. There was such great conversation last year, and I know there will be great conversation when we go to it as well today.
So it's obviously something that's been happening this week leading up to like an EMS summit. I mean, Nevada is a great place, if you will, for getting people together in the same room. It seems like we all share these common causes, and there aren't a lot of, boundaries, I guess, or territories.
No, they're not. And there's a little bit of understanding that I think that geographically, the more differentiated that we are, the closer that we come together to kind of address this, right? And that what we find in the urban areas is that it's not necessarily somebody else's problem, but we have a workforce that's right there to be able to cover the majority of the things that we're doing. When we start getting into more of the rural and the frontier communities, that becomes much more fragmented and difficult. So it's important that we come together with summits like this, and we get experts that are there to be able to talk about some of the topics. And I think it's just really important that it'll be represented by many of the communities from around northern Nevada.
Are there some topics, some contemporary issues that you're really interested in, either in maybe speaking about or hearing about during the summit, Patrick, would you say? What are you hoping to contribute?
Well, I think coming back to our integrated care and really making sure that we're understanding that mental health isn't just mental health, right? That mental health is kind of the whole person, and really making sure that we're aware of that, and that we know that people that have chronic disease, such as diabetes, hypertension, even chronic pain, that they suffer from depression and anxiety at a much higher level. And vice versa is also true, is that the folks that have depression also have a higher level of being ill, of that chronic disease. And I think that if we look at it as an entire system, that it's really important to recognize that we're not just, comorbidity is a real thing, right? Mm-hmm. And if we look at it as an entire system, and what we see is on the campaign trail are healthcare costs. It's a big topic of what's out there. What's driving those costs? And I think sometimes it's that fragmented care. And if we can come together, and again, 75% of all medical visits have some sort of a behavioral health component. Why wouldn't we be treating that? And if we can do that and drive healthcare costs down, not just for the system, and maybe not just for the health center, but also for the patient, right? Then we're doing some real good work.
Our Nevada Health Center's guest today, talking about the accessibility of Nevada Health Centers too, and this connection to chronic disease. And I know, Erin, with the work that you do in the community, you see that a lot of this is influenced by lifestyle, and people coming together for important causes like the recent Zero Suicides Walk and Run. You were able to be a part of that, weren't you? Yes,
and that was there was a lot of turnout. There were so many people. And to me, it was nice to see all those people come together for one cause, which is, the stigma around suicide. On the other hand, you're like, oh no, like there's a lot of people here. You wonder, everyone there was probably affected by suicide at some rate, but everyone there is for the common goal is to let's talk about this hard subject. Let's end the stigma. It's okay to not be okay, and let's be there for one another. And that's what it felt like over the weekend. So having more events like that are surrounding behavioral and mental health, and being able to support as an organization and on a personal level does feel good. And it takes all of us to get people to come together.
Well, and that's why Nevada Health Centers has also been involved in the Safe Talk and the Assist trainings. We're hearing great things about your lending to those opportunities, Erin.
Yeah, thank you. So those have been significant, I would say, with Nevada Health Centers. We have hosted and held 7 different Safe Talk and Assist trainings. We trained nearly 60 of our employees in Safe Talk training. And if no one knows what Safe Talk training, it's a 3-hour training, and it goes over, signs and symptoms of what to look out for if someone might have suicidal ideation, and how to get them the help they need. Assist training is more intensive. It's 2 days, and that one, I've done that training as well. And that was interesting because you do a lot of role playing, but it kind of feels real at some point. You're like, oh my gosh, that was kind of hard to do, to, talk about. And then you learn about all the resources. And we do have resources here. And that's another kind of eye opener is, not everyone knows about them. Some people might be used to being in their certain communities within Elko or their certain groups. But we do, at the end of the day, have these resources, and I think everyone should be trained in these trainings. Zero Suicides, they're the ones who taught the trainings. We just hosted them. We also did it in Windover as well, and Windover is also a tight community, and they had EMT personnel come into those trainings, so that was kind of cool, because then even at those trainings, people make that connection of, oh, well, we have this resource here. If you ever have a patient or if you know of someone, send them here. So that was, that's been good for our organization and community.
Erin Bernius is our marketing outreach specialist with Nevada Health Centers, on our guest here on Elko Live today. And Erin, thanks for sharing that, because that all goes to show what's been happening behind the scenes, and then obviously what Nevada Health Centers has been actively in recruiting, because we do need more of these services when you get that warm handoff like you were talking about, Roger. And so exciting news in that you will have a new licensed clinical social worker on board.
Yeah, she is going to be joining us in early November, and she's got many, many years of experience, and this is a community that she has been around to look around and really liked it, and felt like she'd fit right in here, and excited about that opportunity, and we're excited to have her.
That's great. And it is in addition to the team that you have in place. In fact, we know behavioral health is just one of the many components of Nevada Health Centers. And we really should emphasize that the centers were founded in 1977 here in Elko, located at 762 14th Street. It's hard to admit this, but it's almost hard to get in because there's so much need. I mean, and that's just the truth. And so you are trying to recruit people, and this is an active engagement.
Yeah, there's, along with the Affordable Care Act, when it seemed like access was a lot easier back then. But with the Affordable Care Act, that meant that people were able to get access. They had insurance. They were able to get the health care that they needed. But that did open the floodgates, because there wasn't enough of us as providers out there to be able to treat. And so it is trying to catch up with that wave that has happened. And at the beginning of the show, you had mentioned about the pandemic, and since the pandemic, especially on the behavioral health and mental health side, the need for the behavioral health providers and the number of patients in need of even just stress, right? Stress is a term that's almost a badge of honor. I'm so stressed. I got so many things going on. I don't know how to do, but they don't want to talk about anxiety or depression. And so that stress manifests itself, right? And it affects our health. It affects our ability to do work, and it affects our family lives and our friendships. So, we are recruiting hard, but there is a shortage. And I also sit on the chairman of the board of a area health education center, and our job is to be looking into the future and recruiting young people and training them for healthcare careers.
Mm-hmm. For example, at Great Basin College. And Erin, did you want to add to that too?
Yeah, I mean, it's no secret that recruiting in Elko and in rural areas is hard. And I think it's hard because, like, I grew up here, and it's Elko, and the nearest airport is 4 hours away. We're used to that. But say if a provider comes from out of town, they get here, they're like, what do you mean? Like, an airport is only 4 hours away. So I think this is good to bring up in the terms of, like, if anyone out there who's hearing this, like, knows of anyone who's qualified for not only a behavioral health provider, but a medical provider, send them this way. And because Elko County in general is an amazing place to live. I might be a little biased because I grew up here, but I think it's just a matter of, showing what Elko is, and it's hard to recruit everywhere, it seems. Not just Nevada health centers, and it kind of seems like it's happening all across the nation with rural areas. So I think it's just a matter of word of mouth. Let's get those young people to stay here. We have we're actively posting on social media. So it's just a matter of sharing the word, and if anyone's hearing this, send them our way.
And of course, talking about this great quality of life and these opportunities that you can have. Maybe you can turn that into less stress, and you might not need a shopping mall. You have lots of other shopping, kinds of shopping opportunities, or whatever it might be that your restaurants. We have so many of those, and we have so many special events. Even just the outreach that I know we're going to be talking about. But I did want to mention too, that what you were saying, Patrick, is that even despite these challenges, you've been able to see hundreds of patients that you might not otherwise have seen because we have this behavioral health program.
Yeah, and I think that with the pandemic, it really kind of forced some creativity in how we're doing that. And so we do see patients virtually. They can do it from their home. They can do it from any place that they find safe and comfortable and private to receive some of their care and to talk through a lot of the issues. And it's very effective. Obviously there's a lot of patients that might have some technology issues, and so we still have that option that they can come into our health center and be able to connect remotely that way as well. So we can provide the equipment to be able to do that as well if we don't have somebody that's on site. I'm here for a week out of the month seeing patients in person. I like that personal touch. I'm old school. I'm old, period. So, I come from that kind of school. I like to shake someone's hand, and I think that's a really important piece.
So it's nice that you can find that blend at Nevada Health Centers. Some people are really appreciative of the technology, of the remote psychiatry services. That's something that's new that started just this month, right?
Yeah, so we are contracting with a large psychiatry firm. We worked with a number of different psychiatry services that were more national. And we really felt, and I think that this is really important, is Erin was speaking earlier about keeping it local, right? Now, obviously there's no local psychiatry that can fill the need. So we kept it local to our state. And so we're working with a firm that's out of Las Vegas that's going to be able to see the patients in Elko County and all around. So I felt that was really important when we were making a decision that we wanted somebody that understood our state and somebody that understood the issues that we face here.
So it sounds like all of these things, you've been able to accomplish, and we would be remiss if we didn't mention that I know the city of Elko did direct some of the the relief money to Nevada Health Centers. And so you'll be able to go back and make that presentation to the council, right?
Yeah, and I think that's really important. I think that anytime you have a grant, anytime that there's money that's on the table, everybody has to be held accountable, right? And I don't think that we're an exception to that. And we need to be able to deliver on what we say that we promise that we're doing. And as Erin was saying, that the recruiting is really difficult, and it's hard to do. But right now we would not just know that we're making headway, and so we have people, the Calvary's coming over the horizon, I'll say right now, and I feel really good about that.
Mm-hmm. And so the community should also feel that we've invested in this opportunity, Erin, because it is a great investment in the future of our mental health as a community and as a whole. And with all the outreach that you do, and even supporting institutions like Great Basin College, they're trying to train licensed clinical social workers as well. It's like you said, it's all part of this pipeline, and taking advantage of people that want to be here and saying, have you ever thought about this as a career?
Right. And there's a lot going through my head right now with all that, but there have been a lot of positives that we have done as an organization, just not only statewide, but especially in Elko County. We have attended multiple events, whether that be outreach events or networking events, and I really do think we have come a long way, because when I first started doing outreach here compared to now, more people seem to know, I know Nevada Health Centers, I go there, and that's a good feeling. Or now that there's connections that have been made within the community just by, attending monthly providers meetings that PACE holds on to, or that hosts at the library monthly, it's these connections, and that's what's so important. Is I think all of us, there's been so many different organizations. We have all helped each other out at some point, whether that's helping a patient get a resource or getting a patient in to see one of our doctors earlier if they can, if there's a cancellation. And so that's been rewarding in that way. So I think it's also, as hard as recruiting can be right now, I also would like to shine light on all the positives we've done as well.
Oh, I think that's really important, and that's definitely on the list, Erin. And again, we're emphasizing that Nevada Health Centers is just one part of the component. They're Elko Family Medical and Dental Center, and trying to provide this behavioral health outreach in response to what the community need was. There are agencies within the community that just focus on behavioral health, and they are having difficult times recruiting. It's as you said, across the board. So yes.
Yeah.
So let's talk about some of these really cool positives. I know you've had a busy year, and here we are already getting right through September. But the school district has also benefited from the outreach that Nevada Health Centers does, right, Erin?
Yeah, so they helped us, and I could name off quite a bit of organizations, but to save time, I won't. But the Elko County School District, they were amazing because when we came out with our behavioral health guides, we printed 3,000 of those, and we delivered all 3,000, but Elko County School District delivered about 1,000 throughout the whole school district, all the schools. So that was awesome that they helped mail those out, and every school nurse got some of those guides. And you can also find that guide on our website. It's a resource guide within Elko County. So that's been very valuable too, Also, again, making those connections that, and there might be a resource someone didn't know about that was there.
Yeah, I think I have these cards, and that was part of your effort too, right, Erin? I think you guys...
that's Zero Suicides Elko County, but we kind of helped each other with,
distributing these.
Yep.
These came around when the guides came around. The guides went out fast, you're right, and then these resource cards. But the point I wanted to make is just when you see it like this all together, you say, wow, we do have a lot of resources. And Erin, you helped to bring all that together. You kind of had to corral everybody and say, these are the ways that we all work together to help provide these services and resources.
Yeah, thank you. And that was valuable because there was not a partnership with Zero Suicides Elko County until we all came together and we were like, let's do this thing. And it's been good ever since. So.
Definitely, and putting those, putting the faces and the community partners together, just like having Patrick Rogers here, who's a clinical director, behavioral health. He's focused on providing that through Nevada Health Centers, and then, of course, we're talking about the dental center. You've got a dental sealant program that's partnering with the school district. Vaccinations, hundreds of those were given out this year, and I know you'll be at the Elko Senior Center too, coming up very soon.
All of those things. So we got our dental mobile back. It's in our parking lot, and last year we visited 12 schools, and we gave 601 sealants, and that just helps prevent tooth decay for children. And this year we're going to be doing the same thing for second and third graders. I think it's going to be 12 schools again. So that's also exciting because that's just another service we offer, and sometimes it's easier for us to go to patients versus them having to go to us, right? So it's just more effective that way, and it's a very nice mobile. So
fun to visit.
Yeah, it's like renovated, and it's really nice.
Really comfy inside. So you'll be at the Elko Senior Center coming up, right?
Yes, and that's September 26th from 10 a.m. to 2 p.m. We're giving flu vaccinations, DTaP, and pneumonia. And then just a reminder that every Wednesday we offer flu shot walk-ins. Sometimes it might be best to call beforehand, but if you don't have time, just walk in because we know Wednesday is walk-in Wednesdays.
There you go. And that's to get your vaccinations at Nevada Health Centers, again, located here in Elko at 762 14th Street. I still say, because there are a lot of us that have been around, it's the site of the old Elko Clinic.
Yep,
So
that's what I tell everyone. They kind of get it confused. I'm like, it's kind of the old Elko Clinic by the Elko City Pool.
Yeah.
That's where we're located.
just going to be right across from the brand new recreation center, which is being built right now. So
Yes.
a lot of exciting things to look forward to, and that helps the quality of life. Nevada Health Centers has a pharmacy on location too, which is great.
Yeah, and I want to put that out there because sometimes I don't think people realize we do have a pharmacy, and we do. That's also very nice and updated and renovated. You do have to be a patient in order to get your medications through the pharmacy, but it is so convenient for patients. Sometimes they'll have their appointment, and I've heard, and then 10, 15 minutes later, their medication is ready. So that's pretty nice.
Yep, don't have to drive around town. And something else that's really nice is that you have a pharmacist who is bilingual.
Yes, and that goes so far because we have a lot of Spanish-speaking patients. And so Jose, he is so helpful with all of our patients. So that's another plus.
So tell us about this milestone, Erin. This sounds pretty amazing.
This is about the prescriptions. Is that, yeah. We just had our busiest day to date with 160 prescriptions, and that was the day after Labor Day. So that's pretty, I'm not a pharmacist, but I know that's pretty good.
That is, and our pharmacies are so busy. So
Yeah.
again, all of our and that's just another great example. There's a pharmacy right there on location at Nevada Health Centers. And then there is the other thing that's unique about, or important to emphasize about Nevada Health Centers, it is about accessibility and affordability. And so you do have a discount program.
Yes, and that's called the 340B program. You do have to qualify. But once you do, it can save patients a lot of money. And then also related to that, I wanted to say we also have Jovan. She is amazing. She also works at our healthcare center that not a lot of people may know about, and we're trying to get her out there. She can help get patients set up with Medicare and Medicaid. And you know how that can be confusing, and she's always up to date with all the information that patients need, and then she can just help them, walk them through it so they don't have to. So that's another plus. So they kind of, pharmacy and her, they all go hand in hand. And
That's huge to have someone on site at Nevada Health Centers. Jovan can help sign people up for Medicaid, and then to navigate all that insurance information. That's another huge plus to have someone like that.
Yes.
Yes. So just an overall, we just want to make sure people are aware of the mission of Nevada Health Centers and how many patients you're serving, because this is Nevada Health Centers is statewide.
Yes. So I will have to, so on average, we serve 50,000 patients, and that's statewide. And that comes out to about 150,000 visits per year.
Wow.
And then also we have, I talked about our mobile here in Elko. Statewide, we have 5 mobile health programs. And then we also have WIC programs. And then we have 18 centers throughout the state.
And it is important to note that for a lot of people, Nevada Health Centers is very crucial to their family planning. This is where you can see a physician, you can obtain family planning, and you could be tested because, unfortunately, rural Nevada has a higher rate or incident of sexually transmitted diseases known as STDs, Erin.
Yes. So we're, known for that as well. And that's good because it's a safe space for people to come. I don't want people to feel like they shouldn't come if they feel like they might have an STD, but it's always good to get checked. You do have to make an appointment. So I always say the sooner the better. Call as soon as you can so we can get you in sooner. Our local number to call is 775-738-5850.
You're awesome. 775-738-5850 is the number to call for Nevada Health Centers to schedule your appointment.
Yes.
Erin, thank you. We got through a lot of information today. I want to make sure, though, obviously, Patrick, that we have talked about everything you were hoping to address in your visit to Elko today.
Yeah, I think that we've gotten through quite a bit. I think the one thing I might encourage our listeners, if they want to be involved in kind of the mental health and behavioral health aspect here in Elko or really anywhere, there's trainings you can do. And Erin was talking about the Safe Talk, and there's Safe Talk trainers that are in town and local that you can do Safe Talk training. But also looking at mental health first aid, and they have mental health first aid for adults, and they have it for teens. And so I guess that I would probably just encourage anybody that it's not just for healthcare providers, it's not just for healthcare leadership. This is for people that might be supervisors at different local companies. It might be if you're a teacher, if you're a student. A lot of the 17% of all kids that are 12 to 17 years old have had at least one episode of severe depression during a 12-month period. And they don't always go to an adult to talk. So it's nice to be, as a teen, you can be trained in mental health first aid and be able to help your peers.
That's great. That's kind of what our Hope Squad is doing from the high school.
Yeah, that is right. Yeah, that's
awesome. Right. Well, it's nice to know that we have you here to help support us, certainly through Nevada Health Centers. Thank you, Patrick, so much.
Thanks for having me. I appreciate it.
Absolutely. Anytime you want to come back. And then, Erin, you know where home is. And so, yes, right here in Elko.
Much.
Yes,
thank you.
Thank you, listeners, for joining us for today's edition featuring Erin Bernius, Marketing Outreach Specialist and the Clinical Director for Behavioral Health Services for Nevada Health Centers in Elko, Patrick Rogers, our guest on Elko Live today.